and welcome to Frank on Camnet. Very pleased, happy that you are out there, and we pray that you are safe. There's a big story on the 12th of August. However, there's a bigger story going on right now, and that is COVID-19. That is the thrust of our program today. My guest is a friend of mine. I think he's got more fan base than I've ever had in my 50 years in the media. Viewers, my guest, Dr. MUJAJATI. Good evening and welcome.
Good evening, and thanks for having me. And good to see you.
Great job you're doing for our country. First things first, you keeping safe?
We're doing our very best. I got vaccinated. I got both shots for AstraZeneca. I was one of the very first people that got vaccinated from the time they announced it. And we also managed to get our second dose. But we continue to observe the usual requirements of masking, social distancing, and things like that. Just protect others. But I'm fully vaccinated.
Absolutely. Yeah. Put it in perception. Just how serious is this thing here? Where are we right now in this country?
Right. So we clearly flattened the curve, and the curve is coming down, which is good. And I foresee that we should be getting back to normal business. But the third wave was terrible. It's good to also note very quickly that we should have a fourth wave. By most estimations, you're talking about December, January, thereabout into 2022. We should be anticipating a fourth wave. But should we get everyone vaccinated, the fourth wave shouldn't be a bit of a challenge. But the third wave was probably the worst that we've seen so far. And the way pandemics have been behaving is that the next one is usually worse than the last one. Yeah, even here, if you check, the first one wasn't that bad. The second one was bad. The third one, this current one, it was bad than the last.
Let's talk about the third. What were the contributing factors? Where did we go wrong?
A number of things. First of all, you could attribute this at several levels. On the part of the public, we thought that COVID had gone and it won't come back, and so we lowered our guard. Most members of the public stopped wearing masks, stopped social distancing, and we were gathering as normal. And also on the level of the caregivers, like Ministry of Health, for example, I don't think they equally anticipated the numbers that came. You can see from the way our oxygen supplies were replete, like completely run over. I don't think we were very prepared for this, because if you look at the way oxygen levels were consumed, the way human resource was overstretched, space was overstretched, I don't think anybody saw it coming. Whatever preparations were there for the third wave were clearly inadequate. And also the other thing has to do with the fact that this wave coincided with elections. And politicians on either side of the divide could have conducted themselves better.
Tell me, Doc, there was a lot of money, that was set aside for this, especially from the donor countries. Some of the monies was diverted, to roads, construction. Does this qualify what you're saying, that perhaps the government did not realize the seriousness of this situation, or it was the usual thing of misapplying funds?
Clearly, I think one would actually feel that the preparation could have been better. Resource allocation could have been better. But then, pandemics being what they are, even in advanced countries, with all their preparations, they were also run over. In our case, very difficult to say, but one thing is very clear, that we were not very ready for this, because we were completely run over.
Was there proper coordination between the various players, including the private, sector. You're in the private, sector. Did the government bring you on board, to compare notes about the seriousness of this situation?
There has been some level of consultation with the private sector, especially around the issue of vaccination. But with regards to managing COVID itself, most of the private players have been the corporate ones. And a few, private hospitals and clinics have been involved. But one would have hoped that the involvement could have been a lot broader than that.
Let's look at the bigger picture of the management, starting with testing, of people. Could it been done, better? And also, did we keep track of these, tests? I say this because sometimes the results were taking far, far too long. Can we talk about the management?
I think the bottlenecks were in every aspect. And when you look at just the sheer numbers, the sheer load of work, and also looking at the limitations in terms of human resource, it's a bit of a paradox that you would have such a huge shortage of human resource, but at the same time, you have a huge number of human resource on the streets begging for jobs. One would speculate and say, where did we miss it in terms of planning? You talk about the delay in results. It's also part of the manifestation of some of the gaps that were there. But at the same time, like I said earlier, the numbers were just too many, and probably with all the possible estimates, I don't think anybody could have guessed that it was going to be this bad. But in principle, the subsequent pandemics are usually worse than the previous one. The fourth pandemic, which is coming, will be bigger than the third. So these issues that we are talking about now, delays in results and things like that, those will get worse.
Let's talk about human resource. The importance of human resource cannot be overemphasized. This is a two-pronged question I'm going to ask you. Prior to this pandemic, there was a shortage of human resource. On the other hand, there were staff who were being laid off. How do you reconcile this?
Yes, it's an interesting paradox, and to that you can add the fact that there were a lot of healthcare workers who had graduated on the streets and not being absorbed, and on top of that, there was quite a lot of cases of people being gotten rid of at the same time. It's a bit of a paradox, really, to grasp that. I think in the recent years, we witnessed a very unprecedented phenomenon in the health sector, where a number of healthcare workers were either displaced or removed altogether, and things like that. Particularly the removals, or rather dismissals, if you like. There were quite a number. Yeah. I'm not sure whether they are addressing that to try and reverse that. I'm not sure. Plus, also in addition to the fact that you have quite a number of healthcare workers who were on the streets, graduated, everything, they have all the papers, but are still on the streets. They're not being employed. Again, you have to look at the resource envelope. That speaks to the fact that, yes, the desire may be there to want to employ and deploy healthcare workers, but maybe the resource envelope is not robust enough, or is not big enough to accommodate everybody. Also, in terms of health, is not the only probably need that the government has to look after, but it just tells you that there are challenges in terms of cash flows or resource envelope.
I'll be coming to back to the human resource. You talk about, being overstretched in terms of resources. I mean, when you see where some of the money is go to, luxuries, for example, for government officials, ministers, cruisers, are we really looking at priorities here, Doc?
I think, you see, for me, my argument has always been that there's typically nothing wrong with senior government officials having reliable transportation. And also looking at the terrain in which we are, it's expected that they will have, those, 4x4 vehicles that they need to use, looking at our terrain and things like that. However, if what you're asking me is a situation where people have more vehicles than they need for their day-to-day operations, then that raises questions. That raises eyebrows. And also, if people are amassing wealth at a rate that where you can clearly see that there's an exponential increase in wealth, that also raises questions. But at the same time, you want to also be fair and note the fact that managing healthcare, or rather healthcare as a whole, is a very expensive venture. It's not a very cheap undertaking to provide healthcare to a country. Healthcare financing or funding for healthcare is a very, very expensive venture. It requires one to be very deliberate about it. But over and above that, it takes a very strong commitment to being frugal with resources and putting a tight lid on controls so that you manage pilferage. Another waste of resources has to do with, you see, when commodities and drugs expire, you have to quantify that, because that's money that you're losing. And how much of that went into expired drugs? How much of that went into just wastage of resources? How much of that has gone into pilferage and things like that? So it's one thing to allocate resources, but it's another how those resources are looked after, particularly in the health sector, because if resources are not properly managed, it shows. It shows in the quality of healthcare that you're providing. It shows in the number of people that are dying. It shows in the number of people that are getting immobilized or disabled. It shows in the numbers of people who are unable to be productive because their health is failing. And their health is failing because sometimes it shows in your capacity to actually look after those people and bring them back into productivity. So the whole thing, for me, when you talk about healthcare financing and funding to the health sector, allocation of resources is just one arm. It's also very important that those resources are well looked after. And all these things need to play together, especially when we're in a resource-limited place like ours here. When resources are not properly looked after or properly managed at several levels, it actually shows. The first area you begin to see is that your vulnerable population is hammered first. For example, children. Your infant mortality goes up. Your maternal mortality goes up. Yes. The immediate past Minister of Health, Dr. Jonas Chanda, bemoaned our high maternal mortality. It tells you where we are as a country.
What is the problem? We'll be going back, to COVID, but since we've looked at, other issues, related to health delivery, what is the problem, here, Doc? I say this because I know a lot of my colleagues at senior level were directors. The minister was a doctor. The PS is a doctor. Lots of, senior management staff are doctors. They've gone through the mill. They've seen these problems when they're working in hospitals. Why are they not addressing, these issues? Where is the problem?
That's a very fair criticism.
Yeah,
it's a very valid argument. But at the same time, you have to bear in mind that these professionals operate in an environment. So what type of environment have you created? Does the environment allow for professionals to exert themselves and to put themselves out in a manner that fosters efficiency, productivity, and also several factors come into play. we've had ministers in the past who have done extremely well in those ministries, and others who have who did not do very well. Let's truth be told.
Yeah.
In the health space, like many other industries, but it shows more in the health sector. Leadership. Yeah, everything falls and stands on leadership in the health sector. If the leadership is not putting out the correct tone, or the tone is not one that wants to push things properly, in the health space, because things are very sensitive, things begin to unravel very quickly, actually. Yeah.
Pilfering, buying expired drugs that can be toxic, doctor. Which kind of a person does that, who even knows that this is toxic? This is going to endanger the lives of people, maybe even cause deaths. Which person does that?
No, it's extremely unfortunate when you find professionals find themselves in a situation like that. You see, it's much, I would say, on the scale of evils, you are better off, it's not even okay, but you're better off going to buy very expensive drugs, but they are high quality drugs for your people. It's terrible to go and buy expensive drugs that are expired, and you knowingly unleash them on the population. It's regrettable that you would have professionals find themselves in a situation like that. And it's one of the things that we were looking forward to was to see whether there was going to be accountability. Of course, I mean, this is a matter that is very active, still being investigated. Some people are in court. So we can't speak much about it, but it's extremely, extremely regrettable that you would have professionals at so many levels preside over something of this nature. Sometimes I feel that we as professionals let ourselves down. Yes, we let ourselves down. If there's an area in our lives where we need to be we need to be above board at all costs, it has to do with health.
Yeah.
The decisions we make in the health space have far-reaching implications. Take the condoms that were distributed that are damaged. You know, the implications of that is that there's a pregnancy out there that is unintended.
Yeah.
There's a child who's born who is unintended.
Could be even diseases.
Could be even diseases, even worse. There may be some who have even died as we speak.
Yeah.
Now, the basic question anyone would ask is that, has an impact assessment been done of those, drugs that were distributed, condoms, gloves even, that were distributed that had, that were damaged? Has an impact assessment been done? Do we even know the real impact or the cost of doing that? Remember, these things came at the height of the pandemic as well. So some of them were PPEs. So you distributed PPEs to healthcare workers, and the gloves were damaged. I think that it's extremely sad. For lack of a better word, it's criminal, and it should be described that way. I can't think of a better way of describing it other than that, because you see, when you are in the health space, either you're a doctor, or a nurse, pharmacist, if these things were done by non-healthcare workers, you would think that, okay, maybe, just maybe they didn't know. But for us, we know. And I think that as professionals, that incident will continue to be a dent on ourselves as professionals. And I think that we would have to really work hard to undo what was done.
Yeah.
And also to bring confidence.
Let's give credit where it's due here. The government has built a lot of hospitals, a lot of medical, centers. But having said that, most of these medical outlets lack equipment, lack oxygen, lack gloves, lack so many things. How come become this imbalance again. You know, who is part of this planning, you know, in a team? Surely if you build an amazing, you know, structure, you must also put equipment there. You must also put everything, you know, that is going to complete, you know, the whole delivery in a center.
It's some kind of a chicken and egg situation.
Yeah.
What do you start with?
Yeah.
Do you start with the building, or do you start with the human resource, or do you start with equipment? I would say you start with the human resource. Build the capacity first. Because, I mean, someone argued you can actually treat a patient under a tree if you know what you're doing. And yes, you can. Yeah. But at the same time, the other argument is that, look, there's value in having infrastructure. And I agree. But also you have to bear in mind that a flamboyant building does not treat patients. No. The building can look very nice, but what do people get when they go there? Yeah, because that's the other issue. And the argument of saying that you can treat a patient under a tree, people can come to a tree and be treated successfully and go home, provided you have highly skilled manpower. Okay, and you have, you know, adequate availability, just basic requirements. Yeah. Now we sometimes, one of the things that worries me about our health space, and this bothers me quite a bit, is whether we are doing enough to ensure that we are producing high quality human resource. It's one thing to insist that government employ this one, government employ the other one, but who are they employing? And what's the quality of the people we're employing? Because that also has an impact. What you also need to bear in mind is that we've had a plethora of training institutions in the health space. Is this something that is going to come back and bite us at some point? That, for example, if you take a country like the UK, the training of, for example, of doctors was a government, exclusively government job. It's only recent that they've allowed one or two private universities to get into that space, but with a lot of controls. The reason is very simple. When a government is training healthcare workers or they are training doctors, they're not training them for profit. It's not a profit-driven endeavor. So the commitment to quality and ensuring that is different compared to, you know, a private facility. Not to say that private institutions cannot produce high-quality doctors. They can, and it's very possible. But it just requires a very diligent hand to keep an eye on how they are producing healthcare workers. Because if we do not do that, we will have a new crisis on our hands, where we have very nice buildings, like you have mentioned. You have all the drugs, like you've mentioned, but the outcomes are not improving because we did not pay attention to the quality of production of healthcare workers. So this whole thing has so many facets to it that actually need to be put together. Potentially, yes, a very strong base has been built. You have a lot of buildings that have been done. Let's see where this goes from this point going forward. But one of the big issues that has to be looked into, it's sustainable resourcing of those buildings, sustainable resourcing of those facilities, because they need funding.
We talked about the importance of human resource, doc. I see that a lot of government doctors had been moonlighting. I don't know about now. Does this point to the fact that human resource in government institutions are not adequately remunerated?
Oh no, that's a perennial issue. There was a period when remuneration of healthcare workers in this country was very strong in the region. But I think with the way the dollar has been behaving, the kwacha has been behaving against the dollar, the relative, buying power has been dropping. Yes, of course. But the issue you have in Zambia is that when you're comparing our healthcare system here, or our capacity as a country to pay healthcare workers from a government perspective, and you're comparing to other jurisdictions, you need to be very careful how you do that, because some of the jurisdictions we pick on, if you really look at them, you will find that they have a much bigger private sector than public sector. If you take South Africa, the private sector is much bigger than the public sector. Namibia, same thing. The private sector is a lot more, bigger than here in terms of provision of healthcare services. Zimbabwe, same thing. That's why Zimbabwe, despite the economic crash, they continue to be robust. Why? Because their private sector is, stronger. Now, what makes the private sector stronger is because citizens are used to paying for the services. In here, citizens are not used to paying for the services. That's why I find that insurance is not very strong. So, healthcare services are more of a social an issue than a revenue generating activity, even for the government, for a number of years. And as long as it remains that way, remuneration will be dependent on taxation. And as long as it remains that over 80% of service provision is left in the hands of government, what this tends to happen now is a situation in which we find ourselves now, where we have increased our production of healthcare workers on one hand, and the biggest employer in the market is not the private sector, it's still government. That's why you have a lot of people. It's inevitable. You will continue to have healthcare workers on the streets and expect that number to increase. Why? Because we have a healthcare delivery system that's heavily dependent on the public sector. And the public sector, most healthcare services provided are free, or at least are supposed to be free, as far as this country is concerned from the time we began. And that being the case, the capacity for government to pay healthcare workers will always be limited. Yes, it will always be limited.
We continue digressing. We eventually, come back, to COVID-19. You've just mentioned the insurance, but before we do that, still on human resource, why do we still have expatriates then? If we're able to pay expatriates, which is still many, then why are we not paying our own staff well?
We are a society of so many contradictions. Yes. There's so many paradoxes in the way we do things here. So many. And sometimes you wonder, you have healthcare workers on the streets, but you've employed the expatriates. Just, I think a week or two ago, I was speaking to a young man who graduated, went out abroad, Zambian, trained here with University of Zambia, went abroad to specialize in an area, came back. He's still on the streets, I think about 9 months now.
Really?
Yes. And the area in which he specialized, you have less than 6 people in that space.
Wow.
Why? Because, there's no funded position for him to be, employed or deployed. And this is the weakness in a system that heavily depends on government to provide healthcare services. We need to get to a point where the private sector, our private sector in Zambia is very small, by the way. It's a lot smaller than Kenya, a lot smaller than, I can mention countries, it's a lot smaller. And because it is small, we all look to the government to employ people, which is a very, very unfortunate development. And the other thing that makes it very difficult is that healthcare as a business in Zambia is a very difficult proposition. And that's why I find that a lot of people don't go into it as a business, because banks are shy and banks are risk averse in Zambia to fund healthcare projects. And that being the case, the majority of healthcare facilities we have in this country are too small compared to what you see in other parts of the world. If you take Kenya, for example, they have monstrous hospitals, huge things, but all private. Why? Because they have mechanisms of capital, and capital is cheaper. So there are all those issues that come into play, and for a foreseeable future, we will continue to have this problem as long as government continues to be major employer of healthcare workers. We need to change that narrative. I don't know how, but at some point it has to shift.
Absolutely. You made reference to the insurance. You know, the government has, facilitated the national insurance, health, program. Is this a good way? Is it going to take care of the expensive access into health delivery, health access?
You know, in theory, it's supposed to. In theory. Yes. And of course, it's been rolled out. It's early days. You don't want to punch too many holes in something which is just, starting out. It has a lot of potential.
Yeah.
We are yet to see its impact. And we are yet to see its full potential. So far, it has had its own teething issues in terms of how it's been rolled out. We hope that those teething issues can be resolved as quickly as possible, so that we can begin to see the real intention. Insurance works provided it's run properly, provided the contributors are also a lot. The other thing that will impact the insurance the insurance program for Zambia is that the number of contributors compared to the number of people who are supposed to benefit from the same is disproportionately too big.
Yeah.
So you have a very small group of people who are contributing to the fund, and then you have a very huge number of people who are supposedly supposed to be benefiting from the same. Those funds will be overwhelmed very soon. And that weakness is a systemic weakness. It has nothing to do with the team that is managing the insurance thing right now. If they don't expand the base of contributors, it will struggle to a point where it may even ground to a halt. I can give you examples. Ghana had that problem, whereby government even started getting money from its pocket and to put money into the insurance fund. We don't want to get to that point in Zambia. Then why did we even create it? But we need to fix this thing where the number of contributors to the fund needs to increase. If it doesn't increase, this thing will fail.
Right. Let me go back. Please understand, viewers, I'm trying to look at the bigger picture before we go back to COVID-19. Tomorrow you heard again another paradox. We're not adequately providing for these health deliveries, but we're still sending patients to South Africa, to India. Some of them don't even recover. Even when you're sending them, you actually know that this patient is not going to recover. Explain that.
Those have been very difficult decisions. Some of those decisions, I have been part of them. Some of them, I have not been directly part of them. They are difficult decisions to make. How do you decide who to send abroad? And on what basis? And the factors that drive the decision, some of them are medical, some of the factors are non-medical. Non-medical in the sense that some people are VIP or they are linked to VIPs or politically exposed persons. And yes, you are made to make a decision that is not necessarily medical, but you are managing relationships or you are managing your bosses or your superiors. Those are realities on the ground. You see, there's really nothing completely wrong with sending patients abroad for treatment. There's nothing wrong with doing that, because as long as the goal is that you're trying to save life, you're trying to salvage a life, there's nothing wrong with it. It becomes a problem when it's mismanaged.
Right.
When you send anything and everything, or when there's no structure to who you are sending, and there's no accountability of why you are sending certain people abroad. But otherwise, on the whole, as a principle, it's a very good principle to send some of your citizens abroad to go and acquire these services. But at the core of that argument, you also need to ask yourselves as a people and as a country, and begin to ask yourselves whether, for how long are we going to do this? At what point do we stop and say, can we start building our own capacity here? And where do we start from? What are the lower-lying fruits? Because there are certain things that can be done right here, today itself, where you don't even need to send people abroad. You have the skills, you have people, you have everything you need. And then I'm sure you ask me, so what's missing? To take us back to the issue we had raised earlier, that at the core of everything in the health space, leadership is everything. Leadership, and here by leadership, I'm not talking about, because the challenge usually in Zambia, when you mention leadership, our minds dash to politicians. No, leadership is at every level.
Right.
And we need to have a situation where in all our aspects, particularly when you are running the health space, when you hear the word leadership, we shouldn't dash to politicians. Leadership is at so many levels. So it needs strong leadership.
Right. Finally, back to where we started from, COVID-19, not much was known about, this, issue, this major, problem, this virus. Still not much, is known about it. Has this impacted the way Zambia is managing this, including the medical staff?
Yeah, a lot actually, and not just ourselves here, it's everybody across the globe. I think our field of medicine for a very long time, we were secluded. The struggles you are seeing with COVID openly, these are things which used to happen behind the scenes. Now people can see how we struggle as professionals. COVID has really challenged the medical fraternity. It has stretched the medical fraternity to its limits. Despite all the challenges we listed, I think that, to be fair to the Ministry of Health, they have shown some resilience. Yes, they have shown resilience. Look at how finally the curve flattened and now it's coming down. Of course, we've lost a lot of people. There are some people who died who shouldn't have died because maybe there were some lapses. But if you look at the entire picture as a whole, I think that we need to still be able to acknowledge that the Ministry of Health has done relatively well,
right?
Despite all the problems. But COVID has really challenged us. It has challenged us in the way we perceive the world, in the way I hope that at the end of all this, one of the things that I'm looking forward to and hoping that we have learned is, to what extent are we pushing the agenda of self-reliance?
Research, for example?
Research. Sending patients abroad for things that can be done here. To what extent are we building our own capacity? And I think if that is not done, then we are not learning anything. We're not learning anything. You've raised the issue of research. A lot of times I get asked, Doctor, how come you Zambian doctors, your friends are developing vaccines, you are not? How come these vaccines that are coming here, none of you doctors are researching on them? One thing people forget, and this needs to be very, very clear, we need to make this extremely clear. The simple question is, who is going to pay for that? I mean, who do you want to pay for those things? I mean, yes, skilled manpower is there. But it still requires not just money, it also requires technology. You need to invest in the correct technology, invest in the correct equipment. And also, of course, you have to have the budget for it. Now, research by its very nature, the reason it's a very expensive venture, particularly in science, is that you get things wrong more than you get them right. Now, every time you get it wrong, it's a cost. And that's something that people don't get. The reason these very advanced countries are able to do this is because they do have money enough to push into these things. They can afford the losses. They can manage those losses. Are you going to push $800, $1 billion into research, into a drug, when you are still grappling with basic issues of stunted children? You're still grappling with basic issues of malnutrition. I don't think any government would do that. They will go and try and address the problems of malnutrition. If they had $800 million, they'll go and put it into things that are more pressing. Yeah. Not that research is not important. It's just that at our level or at our stage in development, there are just certain issues that are an inevitable priority. And it's inescapable. Another way of going around it, for a third world country like ours, or a developing country like ours, is to fund universities.
Right.
If you can fund universities adequately and give them the necessary incentive, it makes it a lot cheaper and easier, because these are things that these guys do all the time. So fund them. So put something in the budget for research and development, and challenge them to bring ideas that can be funded every year.
South Africa, I'll be getting back again to our own stuff. South Africa now has got a license, to produce some of these vaccines. Is there any way we can tap into that? I don't know. I'm not a medical, patient. I've not heard that some of our doctors are going to South Africa to see what is happening, to be part of this emerging, African, medical family, for lack of better way of putting it.
Kenya is doing the same. On this side, Kenya is doing something similar. South Africa as well. So what is going on there is a situation where the vaccine has already been developed. You are just a secondary. And it's a good place to start. You can't always start everything from the scratch. Because what that does is that it also pushes you to want to develop the necessary skills, bringing the necessary technology, bringing the necessary exposure of your own people. South Africa is very near here. It's something that can be done. You could, on a government to government.
Absolutely.
Send a few people for exposure. And see if you can replicate something here as well.
Right. I'll be getting back to the vaccine now. Again, I go to the front line, staff. You hear so many stories, sad stories, how our hardworking angels, lifesavers are overstretched. Are we looking after them well?
That's a difficult question. I'll tell you why it's a very difficult question. It's very difficult to pay or to remunerate or to compensate. Let me use the word compensate. It's very difficult to compensate a healthcare worker based to the extent of their value and contribution, because their value and contribution is life. So how much is life? So let's put that aside. So when we say adequately compensate them, I think that when we put it in context, are we paying them an economic wage? Are they able to, live a fulfilled life with the wages that we're paying them? At present moment, to be honest, no. Our wages are very low. But what makes them low is because, remember what I said earlier, that our healthcare system is heavily dependent on the public sector. Government is, you can argue in this country that the Zambian healthcare system is 80 to 85% public driven. So if you're a doctor or a nurse, you're looking for a job, most likely 8 out of 10, you'll be employed by the government, not so much the private sector. And as long as that remains the case, remunerating healthcare workers to the level where it's comparable.
Shouldn't there be a special fund specifically for these some incentive?
You should have some incentive of some kind, but the question is, who pays for that incentive? Because somebody has to pay.
That's a difficult one. There's so many ways, Doc, of appreciating these people. Let me give you an example. We rarely talk about how difficult, challenging you know, these frontliners are facing. The other day I was watching TV. I saw a billboard at the hospital, okay? And the catch line was, "This is the home of heroes." I mean, that's an appreciation. It has nothing to do with cash. We're showing these people that we love them. We care about what they're doing. I mean, I'm not specifically talking, yes, cash is good, but are we doing other things really?
Here's what you do.
Yeah.
I'll give you an example. If we are going to say, as a country, that we are resource limited, but at the same time we are seen wasting the same resources we are saying are limited, what are you saying to those people who are sacrificing?
Yeah.
It becomes a very unfortunate moral argument that healthcare workers are bending over backwards. Some have even died. Some have contracted this same COVID, and it has left some of them permanently damaged. Okay, who is compensating them for that? Okay, but at the same time, that's why I'm saying that we are a society full of contradictions and paradoxes. That at the same time, headlines of resource wastage, you read them in the news, you know, over and over again. But at the same time, we turn around and tell them, look, we can't afford. They continue to. What are we saying to them? It's a lot easier for these healthcare workers to continue to sacrifice, provided we are all sacrificing. But not where we are asking them to sacrifice, but they can clearly see that you're not sacrificing yourselves.
Absolutely.
So, incentives, we can discuss them, but at the same time, if we can't afford, demonstrate that you can't afford. Not where we are saying we can't afford, but headlines of wastage are all over the place. That contradiction will continue to be a problem, and it discourages them.
Absolutely. Vaccine. We got Zerenica, which was here. Now we got Johnson and Johnson. To date, only, I think, maybe around 500,000 have been vaccinated. How have you handled as a government, as a minister, as a government? Have we done well? Could we do, better? How do we deal with the notion of anti-vaccine? The people who don't want to be vaccinated. How have we handled? If we have vaccinated 500,000 people out of 18 million, this is just a drop.
No, it is a drop. It's a very small number. I mean, kudos that we've vaccinated 500,000, but don't pop the champagne bottle yet. I mean, that's not the number you should be vaccinating. You should be vaccinating close to 10 million people. For you to say you're comfortable, it has to be close to 10 million.
Where do we get the vaccine? I mean, we're at the mercy of donors.
And that's the issue. And it's not just a Zambian problem, it's an African problem. Most African countries are facing this same issue of access to vaccines. And also remember, there's a global political agenda that comes with these things. So there are a lot of power plays that come with it. But I think that as a continent, when it comes to vaccines, I think that we could have done better. It's sad. That's why sometimes when people criticize us healthcare workers and say, your friends in these parts of the world are doing these things, you guys are not doing anything, it's difficult to rebut or to argue against it. Yes, but I think that African governments collectively could have done a lot better.
What about these myths of the anti-vaccine? Is this not making it difficult for the government to vaccinate more people?
No, initially, yes, but not anymore. I think for Zambia, initially, it was a challenge. But right now, no. A lot of people want to get vaccinated. Yes. A lot of people want to get vaccinated. Because I think now the message is now sinking. I think what has changed our minds has been the fact that, you see, COVID previously was just statistics that the minister used to read about.
Yeah.
And you didn't know a person next to you or a relative who died. This particular wave was putting names to those numbers and faces. So there's no single person that I know who has not lost somebody they know.
Yeah.
Either a relative, a brother, or a friend, or a neighbor. We've all lost somebody. And because of that, because we've now seen it and smelt it and touched it, everybody now wants a vaccine. And these queues will continue. The challenge to the Ministry of Health, or government as a whole, is how are they going to build the capacity to make sure that everybody gets vaccinated in time before the fourth wave comes? Because we know the fourth wave is coming.
Yeah.
We know. And by then, how many will we have, vaccinated? And the vaccines are coming in drizzles. You receive 100,000 here, 200,000 more. When are you going to reach the millions that you need to reach?
Absolutely.
Yes. So the supply chain also, to what extent have we secured it?
Right. We'll be taking a break very shortly, but before we do that, talk about these other responses, remedial responses, herbals, and things like that, treatment. Could you shed some light on that?
Yes, most of them haven't worked very well. Steaming works, by the way, to the extent that if you are addressing the problem of congestion, if someone is having issues to breathe, steaming helps. Whether you're steaming with plain water, salty water, or you're putting eucalyptus, only for symptom relief. But in terms of treatment, most of these remedies you hear about actually don't work.
Right. One question before we go on break. It's about the statistics. How accurate are these numbers the Minister of Health is releasing to the nation? Is that the base, that it can be done?
I think that the burden of the disease in the community is much higher than the numbers. But if you look at the way they've been testing, to be fair to the ministry, their capacity to test has really gone up. If you look at where we're coming from. I mean, I'm one of those who had earlier criticized the rate at which we were testing. I'm one of those who wasn't very happy in the beginning with the rate we were testing and how we were testing. But this time around, to be fair to them, since I criticized them previously, this time around their testing capacity has really gone up. Except that the demand for the test also has outstripped the whatever capacity they had built. The only thing we need to look forward to, or maybe one of the few things we need to look forward to, is that when the fourth wave comes, we should show that we learned our lessons.
Right.
For example, we should demonstrate that we have increased our capacity for oxygen.
Right.
We've increased our capacity, human resource. We've increased our capacity in terms of bed space and also community care for COVID patients. You saw a lot of community where somebody has COVID, they're sending them home.
Absolutely.
And the reason you send them home is because, you see, ideally, COVID patients should be isolated. But the reason I'm sending them home because you know that your capacity is overstretched. So that's why that's the basis of my belief that the actual numbers for COVID in the community is much higher than the numbers that were being given. Right. But still, their capacity to test has really improved.
This is Frank on Camnet. When we come back, we'll take in your questions on the phone and messages. Start sending the messages. We'll take a short break. I'm talking to Dr. MUJAJATI. We're looking at issues pertaining to health, and the thrust is COVID-19. This is Frank on Camnet.
Zambia has embarked on an economic journey for individual financial emancipation, empowering its citizens through land acquisition and developing the nation through agriculture. This time, Zambians are coming together, taking it upon themselves with the help of government to develop this great nation by taking individual responsibility and ownership of this great nation. The economic revolution has started. There are thousands of Zambians with a can-do mindset who are resolute, unstoppable, full of confidence and conviction that Zambia's set time of favor for development is now. Don't be left out. This could be the time you have been waiting for. Camnet Television, in conjunction with the United Agrivision Consultancy Limited, will be hosting a national conference on becoming a millionaire through agriculture. Date 1st October and 2nd October 2021. Charges 750 kwacha per person per day, that includes lunch. A limited number of participants through Zoom have also been reserved. You can also be part of the conference from the comfort of your home by registering online via Zoom, joining the people who were born for greatness. Charges for participation via Zoom are only 300 kwacha per person. Time 0730 hours to 17 hours. Registration and confirmation of attendance will take place on the 29th of September 2021. Time 14 hours to 17 hours. Venue, the Healing Word Ministries International, the home of Camnet Television in Abex Hill, Kabulonga Road, Lusaka.
Africa is rising to a new dawn of integrity and accountability. Are you tired of being swindled or buying fake or illegal properties? Would you like to sell or buy genuine property? Would you like to list your property on both local and international market? Don't waste your time. Call the professionals, the SGK Properties on +260 762 166 018. SGK Properties. Your business assurance is our priority.
Welcome back. This is Frank on Camnet. My guest, Dr. MUJAJATI. We're looking at issues pertaining to health delivery and with a thrust on COVID-19. Please, you can call us now. You can start sending your messages, your text messages. Before we deal with the messages, what you mean they come through on the phones. The vaccine, does this completely protect you from being infected?
No, it doesn't. The vaccine does not prevent you from catching the infection. But here's what the vaccine does, and we need to be very clear on this one. The vaccine will protect you from developing severe infection.
Right.
Or, no, not severe disease, not infection. The vaccine will also prevent you from hospitalization and also prevent or rather reduce the likelihood of death. Now, when you're analyzing a vaccine or vaccines per se, if you look at it from an individual point of view, it doesn't give you the real reason behind why we give vaccines to a population.
Yeah.
The reasoning behind the vaccine is always in the context of the population. What impact is it going to have on the population? Yes. That is why it's very important that when you're vaccinating a population against a highly infectious disease like this one, you need to make sure that you capture as many eligible people as possible. That we'll go back to that issue we talked about earlier, where you were saying we've just vaccinated less than 500,000. It's a drop in the ocean. That's a very important statement you made, and I agree with it, because you getting vaccinated, me getting vaccinated, it doesn't add any value if a majority of the people are not vaccinated. It doesn't. Why? Because it will not reduce hospitalization. It will not reduce the burden on the health delivery system. It will not reduce the number of deaths. Because what you want is that you want as many as possible people who are eligible to get vaccinated. And once you have a core population that is vaccinated, you even see. That's why I find that in Europe, they were watching football. No masks. I mean, in the US, New York has declared itself free of COVID. You know why they've done that? Everyone is vaccinated.
Brilliant.
Yes.
Who's prone, to catching this? Is there some of us, some people out there who's more prone to catch this than others? Yeah.
Well, I think that in terms of infection, we are all equally vulnerable. But vulnerability comes in when it comes to severity of disease and likelihood of death.
Yeah.
That's where now the picture begins to change. But otherwise, in terms of ability to get infected, anybody can get infected. Children, adults, we all get infected with the COVID. Whether even if you are vaccinated, you will still get infected. And you can still transmit the disease, by the way. So that is why it becomes imperative that whenever an announcement is made for us to go and get vaccinated, let's go and get vaccinated.
Absolutely.
Yes. Now, when you look at vulnerability,
Somebody on the good evening. Your name, please. Good evening. Your name?
Jonathan.
Yes, Jonathan. Go ahead. What is the question?
good evening. How are you, sir?
Very well, thank you. Yeah, just it's a very good topic to get us from the COVID-19. But we need to still fight a lot because because we do have a lot of people dealing with that the vaccine. To the layman's point of view, it is that Iraq cannot have a vaccine. What I say is, if we now discover the vaccine supply or the set, then the set from Thank you.
Did you get that?
No.
Unfortunately, maybe if you can call again, we didn't really get exactly what you were, saying. Can we see if we can have any messages? Do we have any messages on the screen? Do we have any messages? No messages, yet. Please send in your messages. You can still, call us. The mask. I mean, a number of people don't know. It looks very simple, to wear. How do you exactly wear a mask?
Yes. You have to make sure that your mouth and nose are covered.
Yeah.
And when you're putting it on, you don't touch it with your hands. You just, even when you're taking it off, you don't touch it like this, you take it off like that. And don't put your mask under your chin, like I see people doing.
Okay.
Yeah, it's not advisable.
And you wear it once and you throw it?
Yes, especially the disposable ones. Yeah, you wear it once but the rewashable ones, once you take it off, wash it, dry it in the sun. The reusable ones, just make sure that you have, several, maybe 3 or so.
Right.
Such that, when you take off the one that needs to be cleaned, you put it away, you clean it, and then you wear a clean one.
Right.
And make sure it's pressed. The reusable ones should always be pressed with a hot iron.
The variant that is being talked about in South Africa and in Europe, can you educate our viewers about this?
No, variants are plenty actually, and they will continue to come up. It's the nature of the virus; it continues to change, and the reason the virus keeps changing is because, as an organism, it wants to survive also, and it survives by changing itself. And in medical language, you call that mutating or mutation. So it will continue to change itself. Now, as it is changing, you will find that it also changes its characteristics. It may be it may become easy to transmit.
Yeah.
It may also it may also turn into a virus that causes more severe disease. In some situations, as it is mutating, it may become useless. Yes, it's there, it's infecting you, but it's no longer causing disease. So all these mutations are a matter of chance. It just depends on what it has turned into. Yeah. And they give them, letters, these Greek letters, delta, lambda. Yeah.
Before, I ask you one, do you have somebody on the line? Hello, good evening. Good evening.
Good evening, how are you?
Fine, thank you. Your name, please?
My name is Clive. I'm calling you from Sparta.
Yes, Clive, what is the question?
Yes, I wanted to, I heard the doctor alluded to the fact that there are some factors that are contributing to a lot of young doctors and nurses being in the streets, and one of it is that the major employer of medical personnel is the government itself. I want the doctor to maybe illustrate more as to what can be done in order for government to bring about hospitals and clinics that can be able to absorb some of the doctors and nurses that are trained. Or what can the government put in place, measures that government can put in place in order to open up this space so that most of the doctors and nurses can be employed by the private sector as well as the government, so as to enhance the medical space in Zambia as a whole.
Great question, Doc.
Yes, there are no easy answers to that question because part of the reason is that, first of all, you are in an environment that is resource limited. Now, that said, it doesn't mean that just because you are resource limited, you cannot address yourself to the issue. Very quickly, there are some things that can be done. One of them has to do with prudent application and usage of resources. I think that's from where I stand, that's one of the biggest ones. If we do not manage resources prudently, it doesn't matter what we suggest going forward. You can talk about leadership, you can talk about building this, you can talk about enough drugs, but if resources in general are not prudently managed, it's a problem. And usually when we talk about managing resources, we are quick to point fingers at politicians. No, it's the entire chain.
Absolutely.
The whole chain needs to be prudent in the way we manage resources. We can't be this wasteful and expect to have good outcomes. We can't, and at all levels, and we need to manage that. Once we manage resources properly, the rest of the things that can be done now going forward, after we have managed resources properly, has to do with stimulating the private sector. The public sector must not perceive the private sector as competition. It is not in competition. In fact, you'll be interested to note that both private sector and public sector facilities are under Ministry of Health through the Health Professions Council.
Right.
So when you are sitting as Minister of Health and you're counting bed spaces in the country, I prefer the position where if I'm sitting as Ministry of Health and I'm counting bed space in the country, I should be able to say, okay, I have 100 bed space in Zambia, 10 are private, 90 are public. They are all your bed space as Minister of Health. Yes, but if you were to ask that question today, can anyone answer that question?
No.
So it tells you that we are still perceiving the health sector in a dichotomous position, which is unfortunate. It's one sector which is interwoven. I'll give you one very serious example. When a patient is moving from the private sector into the public sector, say a patient is referred, these are very simple things that can be done to improve things. And if you don't address them, you'll find that there are all these gaps. Just the referral system. Just to refer a patient from the private sector to the public sector, it's a struggle. Why? Because the two systems don't talk to each other. Well, they do sometimes, but not to the extent that makes life easy for the patient. Now, here the question is related to what can we do to improve, absorbing healthcare workers. As long as government continues to be the major employer, you will continue to have healthcare workers in the streets. Yes, you will. Some things you will not be able to change them because the resource envelope is limited.
Yeah.
That is why, if you, for example, you get up today as a doctor and you decide you're going to start a small facility for yourself, minimum you employ 12 people. Yeah. But ask yourself, how many of us healthcare workers can step out and go and open a business in the health space?
Yeah.
If there's a business that's very difficult to operate in Zambia, is a healthcare business. It's extremely difficult.
Yeah.
It's not easy to operate a healthcare business. So it also means that in tandem with trying to build capacity for government to absorb healthcare workers, the business environment in which healthcare businesses operate also needs to improve and capacitated enough to absorb the excess healthcare workers that are coming out of these colleges. But here's another thing. It's okay to train in excess.
Yeah.
But have we thought about training for export? Yes. There are countries that export human resource.
Absolutely.
In healthcare.
Yeah.
So have we thought about training for export? Zambian healthcare workers do very well out there.
Yeah.
But the problem is that we've not formalized the business argument. For example, if you take countries like Ghana, there's a lot of money that comes into Ghana from people that are working outside.
Yeah.
What incentives have we put there to allow to deliberately train people for human resource for?
And then they bring in the money.
Yes, there's nothing wrong with training more, but the issue is that the biggest weakness we have is that we've always had this view that they must all be looking to government for a job. Of course, it's government's responsibility. Let's not give government a free pass here. It is government's responsibility to create jobs for these young people that are graduating, period. But how government does it is that for a long time, it has been perceived one-sided, where no, government must employ. But government can also do the same by stimulating the private sector.
Absolutely.
To absorb. And how do you stimulate them? You see, to grow a business in the private sector is difficult because it's capital intensive. Healthcare business is extremely, extremely capital intensive. All right? And you need to, of course, there are incentives that have been put in place to be fair. If you look under Ministry of Finance, there are quite a number of very interesting incentives that have been put in place. But the missing link is access to affordable capital.
Yeah.
Capital is very expensive, extremely expensive. And banks, they are in the business of selling money, so they are not a charity. They want to get a return on their investment. So you cannot force them to start giving out loans which they know that they are going to lose their money.
Absolutely. If
there are no incentives to. So there has to be a mechanism. It needs to be balanced.
Right.
The answer is not that simple and straightforward, but those are some of the things I can quickly think about, but there's more.
Absolutely.
But those are things I can quickly think about.
If there are no messages, do we have any messages that I can? All right. Good evening, Doc. Is this COVID really caused by a virus or a bacteria? Can a virus be completely treated? Do we have another one? Is that the only one? Those people who contracted COVID-19 and got healed, if their bodies now develop immunity equivalent to the vaccine, anything else? Levy Hospital is like hell. When one is sick because the patients are not properly, treated. Please take note. Those are the three questions, Doc. Anything else? Evening, Doc and Frank. I want to find out for how long can the virus survive on open surfaces? That's the fourth question. Hope you're taking note, Doc. Anything else? Good evening, Dr. MUJAJATI. What is your take on reopening of schools? Anything else? That's quite a lot. That's five questions to be answered in the last 10 minutes of our show.
All right. So first question: Is COVID caused by a virus or bacteria? It's caused by a virus. Can a virus be cured? Yes, people are recovering, and you've seen them recover. The next question was on does an infection confer somebody the immunity that is equivalent to a vaccine?
Yeah.
It does confer some protection, But is it, can it be compared to a vaccine? No. That's why we are saying that the people who survive COVID still need to get the vaccines.
Right.
Both, if it's AstraZeneca, both shots. The third question was on levy.
Yeah.
That it's terrible.
Yeah.
There's bad service. It's difficult for me to comment on that because I've not seen it.
Yeah.
I mean, I haven't been in the public sector for like what now? 3 years now, isn't it? Yeah. I mean, I've been. Yeah. So I can't comment on levy.
Yeah.
Very difficult for me to say. I can't speak for levy. The fourth question was on opening of schools.
Yeah.
I think that we are getting closer to a point where the government should start considering reopening schools.
Right.
Because you see, we've plateaued and we are now going down. They now need to sit down.
So how should these schools manage the students and everybody, the staff, vaccinate all of them?
Especially teachers. It's important that all the teachers must be, if it's possible. Yeah, I'm saying if it's possible. Prioritize vaccination of teachers.
Okay. And there's a question on the metal, on the metal surface.
Yes. I mean, how long does a virus last on the surface? Not very long.
Yeah.
It's not a very robust virus.
Yeah.
Not very long.
Okay.
Yeah. That's why I found that if you just, disinfect the surface, wipe it with a common disinfectant, it wipes.
Right.
Two,
3 questions, short ones before we wind up. There's no doubt, like where we started from, that this is one of the biggest health challenges the world has ever known. Do we run a danger of sidelining other challenges like cancer, HIV, AIDS, just to give an example?
No, absolutely. Yes, of course. You see, expect the numbers or the gains we made in those areas to be affected. HIV gains will be affected. TB will be affected. Diarrheal diseases and upper respiratory tract infections in children will be affected. Immunization of children will be affected. Because it's the same healthcare workers you want to do these things.
Yeah.
And they are few, by the way. So expect those things to be affected. Expect malaria to be affected. Expect cancer treatment to be affected. So it's inevitable. It's an expected outcome.
Right.
Yeah.
Life will never be the same as we have always known it. How should we respond now as a people?
As a people, one hopes that we've learned our lessons as a collective. That number one, there's value in self-reliance. Number two, that there's value in prudent management of resources. Number three, that there's value in pulling together as a people, as a collective. Because to fight COVID, unfortunately, for the population and for everybody else, it does not need health workers. Health workers are at the tail end. To prevent COVID and to fight COVID, it's the community. It's people out there. And if people do not work together and coalesce together and fight a common enemy, COVID will continue to give us problems. We are supposed to be going downhill, but my personal worry is the way politicians are continue to conduct themselves. I know that it's a bit touchy to discuss, behavior of politicians. But look, I'm a healthcare professional. My main interest is life. All right? And the way we are conducting ourselves or the way politicians are conducting themselves with regards to COVID leaves much to be desired, unfortunately. I'm sorry.
Yeah. My final question relates to the elections. First, let me make a comment. I am very disappointed that not many political parties have put health on their agenda. I've not heard much about that. I mean, really, that's life, health. We were discussing water the other day and the economy in general, but nobody specifically, talking about health. You need a health nation. You win the elections, you need a health nation. We want to hear, from you. As a rider, to that, your expectations from whichever government comes into place after the 12th of August, what are you expecting from them, especially in terms of health?
Well, I think you're right. Your observation is on point when you say there's been a paucity of messages or rather the campaign messages have not been as clear with regards to what they want to do in the health sector. What I would want to see in the health sector, for me personally, number one, we need to tackle a wastage of resources. That's, for me, that's the beginning of everything. Tackle wastage of resources. Tackle that. There has to be a prudent management of finances and other resources. That's number one. Number two, for me, we need to ensure that the supply chain is robust enough to detect those issues that we had. Professionals should be empowered enough to be able to detect those things. Never again should we be in a place where professionals are relegated to a position where they are secondary. Professionals need, in the health space, you suffer as a country if you put professionals, if you relegate professionals. It will show. It doesn't hide. They say, you can hide a disease, but you can't hide the funeral. The other issue has to do with we need a robust and reliable mechanism to finance the health sector. In as much as we need to manage the resources, but the sourcing of the funds to put this thing together needs to be robust and needs to be this. We keep talking about the Abuja Declaration over and over again. But it's good that you now have healthcare financing through NEMA and things. One hopes that that works going forward. But also human resource. It's not enough to train people, but what quality are we training? And also, we also need to begin to look at transforming the health sector into not just a social sector which just consumes resources, but the health sector also needs to begin to contribute to the revenue basket through health tourism. And I think that for Zambia, health tourism can actually be achieved. We just need to monetize it properly.
Doc, this has been one of the most difficult interviews I've done, one of the most emotional, but one of the most important, because it touches on life. Thanks to you for this interview. I mean, I've lost about 10, 15 friends and relatives in the last few months. There was a day, when I lost two, my cousin and the wife in a hospital in England. One died about midday. The other one died in about 16 hours, wife and husband. It's very emotional, but we had to do it. Thanks for your thought-provoking issues, and please keep up the good job.
Thank you. And it's always a pleasure to chat with you. We have a country to serve.
Absolutely. I'll be back next week. Tomorrow I'm back on my radio station, Capital FM 99.7. Let me thank Isaac and his team for the usual good job, and of course you viewers, and indeed my co-producers, Pastor Chiluba and Mrs. Chiluba. My phrase, I'm sure you know it by now: do your very best, and God will do the rest. Your very best to ensure that you abide by the health guidelines and you look after yourself. Subsequently, you look after your neighbor, your relative, and everybody. Thank you for watching. God bless you, and good night.